In this series of videos, we'll discuss how to combat weight bias and stigma in your research, clinical practice, and everyday experiences. Before reviewing our topic learning objectives, let's first think about why we should work to combat weight-related bias and stigma. Research has shown that this is an important effort to make sure that we're creating inclusive environments wherein the people we're working with feel that they are honored and respected. Addressing weight-related bias in your practice is important to help you prevent errors that may arise when you're making assumptions about someone based on their weight or appearance. It also helps you build rapport with the people you're working with and strengthens your relationship and communication with them. It also makes the most of limited interaction time that you may have in your practice. Instead of lecturing people about things they already know about or telling them to do things that they've already tried, you're instead collaborating to understand what they need to know, what they want to know, and what they need help with. Research also suggests that when we work to combat weight-related bias and stigma, we decrease risks for the negative psychological and physical health outcomes that may arise when people experience bias, stigma, and related discrimination. Having a more inclusive practice will help your patient to maximize their potential and will help you understand how you can best support your patient in reaching their health-related goals. We have 3 learning objectives for this topic. By the end of this series of videos, you will be able to choose inclusive language and communication strategies when discussing a patient's weight or broaching sensitive weight-related topics. Second, you'll be able to identify and challenge explicit and implicit weight bias. Third, you'll be able to analyze and correct potential nonverbal sources of stigma. This video will cover the first learning objective, choosing inclusive language and communication strategies. When raising the topic of body weight, words matter, and you have the power to choose your words wisely. It's important for you to appreciate that your words, your tone, and your approach may influence how your patients react both emotionally and cognitively to the discussion you try to engage them in and the advice you'd like to provide them. You are likely already versed with the many ways that you can describe an individual's weight status, and you may have little emotional attachment to the different terms. Or you may have much emotional attachment to them and react negatively or positively to certain terms that you've heard. It's important to recognize that the way that you react to a term may differ from how someone else may react to that term, which is likely dependent on your unique weight and health histories. It's our responsibility to choose words carefully to ensure that we're able to build rapport, create comfortable and safe spaces where we're not triggering negative emotions or making people feel judged by the terms that we're using. There have been a number of studies that have outright asked patients what words they would like their clinicians to use when describing their weight, and in particular excess weight. These are great guides to help us understand which words we should use versus words we should avoid when discussing weight with a patient. The figure presented here provides findings from one study, but note that many of the studies on this topic have shown similar findings. The x-axis represents the rating scale that study participants used to rate the different terms presented. Participants were asked to rate how desirable they perceived terms like weight, BMI, heaviness, obesity, or fatness when thinking about a clinician talking to them about their excess weight. Terms on the right side of the figure were ranked more desirable than terms on the left side of the figure. Here we can see that study participants rank the terms weight, BMI, unhealthy body weight, unhealthy BMI, weight problem, and excess weight as the most desirable, whereas they ranked overweight status, heaviness, obesity, large size, excess fat, and fatness as less desirable. In sum, we have clear data showing us the terms patients prefer when discussing their weight. You may have already noticed that the more preferred terms were somewhat more neutral terms like weight, excess weight, or BMI. In contrast, the less preferred terms may have more emotional context around them, which may be triggering for patients, especially if they've experienced stigmatization and discrimination based on their weight. This means that in your practice, you can be mindful to use terms like weight, excess weight, or BMI when broaching the topic of weight with a patient, and avoid using terms like fatness. Another way we can show respect to the people with whom we work is to use people-first language. Being mindful to use people-first language ensures that we are acknowledging that people are not their disorders, disabilities, or diseases. People are themselves as individuals, and sometimes they have medical or other conditions that they need help with. So instead of saying an obese person, you should say an individual who has obesity. Or better yet, an individual whose weight status is classified as obese, or an individual whose BMI is classified as obese. Instead of calling someone a diabetic, refer to them as an individual who has diabetes. Instead of anorexic, an individual who has anorexia. Often we defer to the phrases on the left side of this table because they're more streamlined and a little easier to say. But that increase in efficiency is not worth the decrease in respect that occurs when we don't use people-first language. So use the extra words to make sure that you are acknowledging that the individual is more than just their condition or disease. Many times we may be the expert in the room, but we want to avoid the expert trap where we're talking down to people, diminishing their contributions, or implying that their input or contributions are not valuable. We also want to avoid lecturing people by telling them what to do and all about what we know. Both of these tendencies diminish rapport and reduce our effectiveness with patients who may feel alienated or disrespected. They can also waste time because if we're lecturing people on things that they already know, or maybe that they've tried to do and struggle with, we're not being effective in the time that we have with them. So one statement that highlights this idea of an expert trap or lecturing would be if a doctor told a patient, "You're obese, and frankly, you need to make some changes. You need to stop eating so much and start exercising. Stop making excuses and lose the weight." This lecture is not respectful. It's talking down to the patient and assumes that they're not aware of their weight or weight-related behaviors. It's quite possible that this patient has tried to eat less and has been exercising, and it's still not affecting their weight. So by addressing them in this way, you're just making them feel worse about things that they're already struggling with. We know that tough love approaches do not motivate people to change. Other, more sensitive approaches do. Here's another example. Let's say a nurse tells her patient, "Obesity is a dangerous condition that you need to take seriously. Don't you want to live to see your children grow up?" Both of these statements are extremely confrontational, and they'll likely make the patient defensive. This is counterproductive to motivating behavior change. Let's think of some alternative ways to emphasize the importance of weight, the health risks of obesity, and the importance of behavior change. As you'll see, all of these examples are much more respectful and convey a spirit of collaboration between the clinician and the patient when broaching sensitive topics. An interventionist could say to her client, "I'm concerned about your weight, and I'd like to talk to you about it. Is that okay with you?" Asking permission in this way demonstrates respect for the patient and fosters a more open and productive conversation. In addition, expressing concern is a great way to broach sensitive topics. It's not confrontational and shows that you're empathetic to their situation and ready to provide them with the care that they need. Here's another example. Instead of lecturing someone about obesity, you could first ask them what they know and what they'd like to know. What do you know about the risks of obesity? Would you like for me to explain anything to you? You're first assessing what the patient knows to ensure that you're not wasting their time by conveying information that they already know. You're also giving them a chance to ask you for help, to ask you for what they want to know, and to work together to fill gaps that perhaps other providers have left in the past. It's also important to respect the fact that your goals aren't the only important goals here. You may desire your patient to achieve a certain weight status or certain health markers, but they need to be your partner in this experience. So by asking them things like, how do you feel about your weight? What aspects of your health behaviors would you like to improve? Make sure that the two of you are working together to find pathways to change. This helps you begin to evaluate their readiness to change and their sources of motivation. We know that there's no one right way to get healthier. We have many different options, and so finding that happy medium between what your goals are and what their goals are, what you think will work and what they think is feasible in their life, is a really important starting point. It's also important to make sure that you're not talking over the people you're working with, that they are walking alongside you and understanding you. We want to speak clearly and make sure that we're defining terms that they might not know or that might be jargon. Here's one example of how you could explain the concept of BMI to someone that's sensitive and uses inclusive language. We medically define obesity by using a term called body mass index, or BMI. This is a calculation based on a person's height and weight. Plugging your height and weight into this equation, your BMI is 32. Obesity is defined as a BMI over 30. It's important to take the time to explain things. It shows respect for the patient and helps them take ownership over their health. We also want to make sure to express compassion, optimism, and realism when we're working with individuals to develop their health goals. This quote here provides one example of how to do this. When talking to someone about their weight, a clinician could say, "However, I want to emphasize that weight is only one health marker we can assess. Weight can be a first clue that we should look deeper at other health markers, such as your blood pressure and glucose and cholesterol levels. You can be healthy at the weight that's right for you, but even a 5% weight loss can improve your metabolic health." This quote provides a clear explanation. It emphasizes that there are other things that need to be assessed and that there are many opportunities, and it expresses optimism for the patient's ability to make health improvements. I hope these examples give you some good ideas of how you can incorporate more inclusive language and communication styles into your future practice. Let's review some key takeaways from this video. First, your words matter, and you have the power to choose them wisely. Educate yourself about patients' most preferred terms, and don't be afraid to ask patients themselves. They'll appreciate that you respect their opinions and experiences. Existing research suggests that patients prefer for clinicians to use neutral or clinical terms when discussing their weight, such as weight or BMI. Just make sure to thoroughly define or explain any terms that a patient might not be familiar with. We also know that using people-first language is an important way to avoid dehumanizing patients. We examined many ways to broach sensitive weight-related topics in the examples that we covered. These examples and approaches are an important way to convey respect by engaging the patient as your most valuable collaborator. That's all for this video. Thank you for learning with me.